Hey guys, Dr. Childs here. Today we're going to be talking about how doctors literally fail thyroid patients. And to do that, we're going to be talking about a study, what's actually more of a survey or a questionnaire that was given to 12,000 thyroid patients. Now these 12,000 thyroid patients took this study, they answered the questions, then they took all the information, put it together, and we're looking at the results of that study. Now what you'll find is that the results of this study doesn't bode well for thyroid doctors and endocrinologists and other doctors that manage the thyroid, okay? It shows that they are actually failing thyroid patients. And we're going to talk about that. I'm going to break it down. I'm going to make it really easy to understand. And then we're going to talk about what this means for you. The reason I'm making this video is because there's plenty of people every single day. I get a lot of people because I write a lot of information. Or I write a lot about the thyroid. I talk about the thyroid. I have podcasts and videos, etc. And I'll always get comments every now and then about people who say, you just need to go to your doctor. Let's go, don't listen to online information. Go to your doctor. They know what they're talking about. Well, this is really a rebuttal to that sort of argument. And I want to show you that going to your doctor is probably not the best option for you. And here's why. And we can look at 12,000 cases, right? This is a huge number of people, 12,000 different cases showing that going to your doctor may not be the right answer. So that's sort of an introduction to this. If you don't know me, I'm Dr. Childs. I'm an internist and I specialize in helping people with thyroid problems, helping people with hormone imbalances, and of course, helping people lose weight. Today, we're going to do something a little different. I'll be sharing my screen here so we can talk about this. So this is a blog post that I wrote, and I'll be using this just to sort of bounce off of some of the information here. If you want to see the actual study, you can click on this link here, and I'll have a link below, and it'll take you to this when it loads. And this is the actual study itself. So an online survey of hypothyroid patients demonstrates prominent dissatisfaction. Of course, prominent dissatisfaction is an understatement. But I want to talk about that. And to do that, I want to talk about some of the takeaways here. And I'll sort of comment on this. So remember, we're talking about 12,000 thyroid patients who were given the survey and they asked them various questions. They said things like, hey, how satisfied are you with your thyroid treatment? Like, how knowledgeable do you think your doctor is? What type of thyroid medication are you taking? How long have you had this thyroid disease? And they compiled all this information together, and that's what we have. So I think this is a good source of information. It's not the best, obviously, but asking people and trusting that they're telling the truth, I think is a good thing in this situation, especially when there's 12,000 people. So we can look at this information and we can ask ourselves, do doctors know what they're talking about? Do they know how to help? Do they know how to treat thyroid patients? And I think the answer is pretty much a resounding no. In fact, if you look at it, let's look at one of the first things here. One of the first questions they asked was, how satisfied are you with the treatment you receive in regards to your thyroid? 1 being not satisfied at all and 10 being very satisfied. And the average answer for 12,000 people was a 5 out of 10. Now, if I was grading you or if I was grading these doctors and we were at school, that'd be 50%. We'd be failing the test, right? So that's why I say they are literally failing thyroid patients. If they're only 5 out of 10 in terms of satisfaction, that's not very satisfied. So let's look at some of this information. I'll break it down for you. So I've taken bits and pieces of the highlights, the things that I think are most important, and the things I want you to know about and I want to share with you. But like I said, if you want to, you can go back over to the full study. You can read it all here. I'll have a link below this video, and you can go on the blog post and you can see it there as well. So one of the first highlights is that 62% of people who responded to the survey were taking T4 only thyroid medications like levothyroxine and Synthroid. Now, this number is a little bit alarming because it doesn't represent the whole of thyroid patients. In fact, most thyroid patients, somewhere on the order of 80 to 85% of people, so much higher than this, are taking levothyroxine and Synthroid, which tells me that the people who took this survey, the people who actually filled it out, were more savvy and more advanced thyroid patients, because these are patients who were using other T3 medications that contain T3, like natural desiccated thyroid, Cytomel, liothyronine, sustained release T3, compounded T4, T3 thyroid medications, and so on. So we're not talking about the average group of thyroid patients in the survey. We're looking at a more savvy bunch of thyroid patients, which means that the results would be worse if we actually took an aggregate or an average of all thyroid patients. And I've been saying to you guys for a long time, levothyroxine and Synthroid are just not the best thyroid medications on the market for most people. They do work for some, but they just simply don't work for most people. And that's, you can just look at this survey and you can tell why. So 62% of people were taking these medications and the average score that they received was a 5 out of 10. These people are definitely drawing down that average. So that's very important. The second point is 41% of respondents have been receiving thyroid treatment for 10 years or more. So this is why I do what I do, guys. it is not acceptable for somebody to to have a 5 out of 10 satisfaction for 10 years. That's almost half of people who responded to this survey have been suffering, literally suffering with low thyroid symptoms for that length of time. The reason I produce this information, the reason I have this information is so you don't have to be somebody 12 years later down the line still feeling bad, still suffering from weight gain, still suffering from from fatigue, from hair loss, from constipation, and so on. Now, low thyroid definitely causes a lot of problems, but you don't have to continue to suffer from the symptoms provided you're receiving the correct treatment, which is really kind of what we're talking about here. Another important fact is 43% of respondents suffer from hypothyroidism secondary to Hashimoto's thyroiditis. So this is a really good aggregate of thyroid patient because it means that 40%, so 40% of 12,000, that amount of people, so we're talking like 4,000 or 5,000 people, have Hashimoto's thyroiditis. Now, in all likelihood, a higher percentage actually have Hashimoto's in that group of patients. They just probably don't know about it, right? And that's another big problem among thyroid patients is that they don't even get correctly diagnosed because most doctors, if they don't even order the thyroid antibodies, and if they say you have hypothyroidism, they won't even look for the cause because they don't think it matters. So that's another potential issue and a reason that thyroid patients are so dissatisfied. The overall satisfaction was a 5 out of 10. We kind of talked about that before. Again, that's just simply unacceptable, right? That's 50% if we were grading them, and that's just not acceptable. 69% of respondents suffer from weight management issues, which is a major cause of their dissatisfaction. So when they asked these thyroid patients, they said, hey, what are the main things you're dealing with? Weight management, meaning people in the thyroid space, they gain weight and they don't have the capacity or the ability to lose that weight because they're not being treated correctly. So what ends up happening, I have tons of videos on this, by the way, and I'd encourage you to look at them if you're just being introduced to this idea. But what happens is your thyroid controls and regulates your metabolism. So it is in charge of really how many calories that you burn on a day-to-day basis. It's in charge of a lot of other things, but that's one of the most important things. So what do you think happens if your thyroid drops down? Well, your metabolism drops down as well. And if you're not being treated adequately, if you're not being given the right thyroid medication, your metabolism will not go back up to where it should be. And what does that mean for you and your weight? It means you're not going to be able to lose weight, and it means you're going to remain overweight for a long period of time until you can actually get treated. So, putting this together, we have 41% of people who have had thyroid problems for 10 years or more, and 69% of people who suffer from weight management issues. That means there's a big overlap between this group of people. And I think that's true as well. Just ask yourself as you're listening to this, is weight something that's really important to you? And is weight something that you've been struggling with for a long time? And if the answer is yes, you fit into that category. 77% of respondents suffer from fatigue or low energy, which again was one of the major causes of their dissatisfaction. So when you look at these patients in aggregate, a ton of thyroid patients suffer from low energy, right? Low energy or fatigue. And again, that's another one of the most common signs of having low thyroid is low energy. It's fatigue. So how can you say somebody who is being treated for their thyroid, who has low energy as a result of that low thyroid, but is giving replacement medication and still having low energy, how could you say they're treated? Right, you can't, right? That's just a poor way of looking at it. And yet, that is how most thyroid doctors look at thyroid patients. They think if their TSH is normal, then therefore the patient is normal, and any symptoms that they may be having, they're not related to the thyroid. It must be related to something else, which again is a big folly. Okay, so then another last little tidbit that I want to include here is thyroid patients rate the need for new thyroid therapies as a 10 out of 10. And so I want to talk about this, and I've expanded on it below, but really what's happening here is they're saying thyroid patients are being asked like, hey, how do you feel? What do you think is going on? And they're saying, hey, we are suffering here. We think doctors are doing a bad job or whatever it is. And in fact, what's funny is they're not actually blaming their doctors. What they're blaming is the treatment. But what's funny about the treatment is the treatment is solely related to the doctor. So if the doctor gave them the right treatment at the right dose, they'd feel better. And that's why I say this actual thinking is actually incorrect because it places the blame not on the doctor, but on the thyroid medication itself. And that's not true. If the thyroid patient was given the right thyroid medication at the right dose, they would feel better, right? And so one of the most important things that a thyroid patient can do is take the right type of thyroid medication for their body. And figuring out which thyroid medication that patient needs takes a little bit of time, takes a little bit of effort. But there are many different types of thyroid medication, including those that contain T3, which are very effective. In fact, much more effective than medications that contain T4 only, like levothyroxine and Synthroid. So there's one other thing here, we won't talk about this because we kind of already touched through it, but I talk about some of the problems in the study as well in here. So if you're interested in looking at that, it's a survey really, right? It's not an actual study in the sense that it's double blinded and placebo controlled, but there still is value to this sort of thing. But I want to talk about what this means for you. What does the information that I posted here mean for you? Well, it vindicates you, first of all, and it shows that what you're experiencing is not just in your head, okay? It also shows that there are many other thyroid patients out there experiencing the same issues as you. That's why I love this sort of putting this information together so that patients who have similar experiences can come together. And that's why I want to hear about your experiences. That's why I always ask you guys to leave your comments and your experiences below, because it just strengthens our cause. It makes it more likely that if we have a bigger voice, a unified voice, that people will have to start listening to us. Right? So that's sort of the goal here. What it also means is that you don't have to continue to suffer, right? Just because you're one of those thyroid patients who is not doing well, who continues to have let's say weight management issues and low energy and so on. There's tons of other problems, by the way, but those are some of the most common. You don't have to continue to suffer from those. You can do things within your power, either natural therapies, or you can look for like-minded physicians who know more about the thyroid to help you along the way. So what does that mean practically for you? Well, again, I have tons of videos and information on this, but one of the most important things that you can do is switch up the thyroid medication that you're taking. Do not blame your thyroid medication for the symptoms you're experiencing. Instead, look to other options. And one of the easiest ways to optimize your thyroid medication is with the use of T3 thyroid hormone. So medications that include, or medications in this category include things like Cytomel, liothyronine, sustained release T3, compounded T4, T3 thyroid medications, and natural desiccated thyroid. All of those medications, in my experience, are far superior in terms of how effective they are compared to levothyroxine and Synthroid. And I see, people feel much better when they're on those type of thyroid medications versus the others. But your doctor won't even explore those. They don't even, for the most part, you probably don't even know they exist unless you're listening to this sort of information. But there's tons of information available outside of the realm of just levothyroxine and Synthroid. So look into that and make sure you're doing, if possible, switching your medication up and getting on something that contains T3. Now, the last thing I have included in here, the last thing I want you to know is that you can do things on your own as well to help yourself feel better. So that includes things like changing up your diet, exercising regularly, managing your stress, making sure you're getting enough sleep, taking thyroid enhancing supplements. All of these things are within your control. You can't control what medication your doctor prescribes to you because that's up to them. I mean, you can if you find a new doctor, which I would recommend if you're having struggles working with your current doctor. But you can determine what foods that you're putting in your mouth. You can determine how often you exercise. You can determine what supplements that you're taking. Those are all things within your control, and they can help you feel better. So I would strongly recommend that you look into natural therapies as well. And it's a no-brainer. It's not really ever a bad thing if you're going to change your diet up and do more exercise, right? Like that's always something that you should consider. Add on a couple of extra supplements, same thing. It's going to be helpful to you. So look into those natural therapies, and if you can, try to find a doctor that's more willing to work with you, that has more knowledge than your current doctor does in regards to the thyroid. And as you do that, I think you'll be able to feel a lot better. And the next time someone tells you that you need to trust your doctor or listen to your doctor, you can send them this information and show that, on the aggregate, at least in this survey, and by the way, there are other surveys which sort of show the same thing, doctors are failing thyroid patients. They're really not doing very good at their job. And so you can show them this and say, well, if you're welcome to listen to your endocrinologist and thyroid doctor, but on the aggregate, they don't do very well, right? They're not actually helping thyroid patients. And this sort of explains it in detail. So that's all I have for you guys today, but make sure if you haven't already, you download my free thyroid PDF resources. I have tons of information, all designed to help thyroid patients. So if you like this sort of thing, you'll find that information very helpful. And if you haven't, make sure that you leave a comment with your experience below. Is this sort of been your experience as well? Are you having trouble with your doctor? Have you had thyroid disease for more than 10 years and have you continued to struggle? I want to hear about that as well, so leave your comment below. And otherwise, I'll see you guys in the next one.